So I arrived in Hereford about a year ago, and when I arrived there was quite a backlog after the COVID pandemic, so there were long wait times for echocardiograms. Now echocardiograms are really important to get patients diagnoses that can then impact what treatment they need to help their health, so it's very important for us to address this. It's a very useful investigation because it helps us find out if a heart is structurally normal. It lets us know if the pump function is normal or whether it's not pumping appropriately, which we'd call heart failure, and it lets us know what's going on with the heart valves to ensure that they're working correctly and they're not leaky or too narrowed. The reason it was so important for us to make the echo wait time shorter is because we want patients to get their investigations in as timely a manner as possible, which allows us to get the diagnosis they need so that appropriate treatment can be started. We've approached this in several different ways. One is that the management have been really supportive in getting locum support in, so we could start scanning on days of the week that we didn't normally scan on to work through the backlog. Another way is that we've started to triage our echoes more aggressively to make sure that people who needed urgent echoes would get them in the most timely manner possible. And we've also started to invest in training more echocardiographers to help make the service more sustainable going forward.
We devised a plan along with the cardiology management team whereby we would work a 7-day week for a period of 8 months. All of the echo team did extra slots and extra patients, and we also brought in an external company.
Another benefit of patients having a shorter wait until they have their scans is that by getting earlier diagnoses we hope to implement treatment earlier, which will hopefully decrease hospital admissions long term.
We've also invested in an echo simulator, and this enables us to train other members of staff from areas across the trust without inconveniencing a patient. It means that we can enhance and develop our training of other staff to perform basic echocardiography. Altogether, this is leading to us being able to scan over 600 patients a month now.
We get lots of referrals from our GP colleagues when they have concerns about the function of their patients' hearts. We've done some education sessions to help ensure that we get the information that we need to help ensure that the patients that need scans most urgently get them in that timely manner. And there's been positive feedback from our GP colleagues over how the waiting time has improved. We've also upskilled our reception staff to help with triaging to make sure that the patients that need the scans most urgently get them in the most timely manner possible. One of the really exciting things going forward is our plan to upskill and train some of our colleagues in the emergency medical team and the acute medical team to be able to deliver focused bedside echoes to a level 1 BSE standard, which will take some of the pressure off the outpatient echocardiography service and allow inpatients to get some of their diagnoses in a more rapid manner.
It was a challenging time, but it was very rewarding ultimately when you see the waiting list start to come down and you hear from the patients how grateful they are to have received their investigation so that they can move on with their treatment.
I would like to thank the entire echocardiography team because it has very much been a team effort to overcome this waiting list. So our reception and bookings team, our echocardiographers, our fantastic lead Claire Seal, and also the cardiology managers who helped with finding resources to help this be achieved.
Healthcare support workers are the key entry point into the NHS. They are at the heart of our patient care delivery and are key valued members of staff. We were aware that our vacancy gaps were high across the trust, so we introduced a centralised healthcare support worker recruitment team. That team consists of a healthcare support worker project lead, a healthcare support worker recruitment assistant, along with a healthcare support worker practice educator facilitator.
I came into the project a little way in. What we do now is we're with them every step of the way. We start with their training at the very beginning. They see me and my colleagues in the classroom, and then we follow that up through into the clinical areas. We're there for them at any time that they need us. And I suppose having that familiar face and knowing that there's somebody you can come to makes a huge difference, which is shown in the retention.
We're working in partnership with Hoople Care to bring together our resources to double up our efforts to recruit healthcare support workers across Herefordshire. The team works together to ensure that we provide the best outcomes for our healthcare support workers in their positions at the NHS.
We're offering solid training, quite a comprehensive training programme. We include the care certificate if people haven't already got it, and clinical observations. So the care certificate covers the fundamentals of care, and that's things that you would assume that would be easy to do for somebody else because you do them on yourself, like cleaning your teeth or having a wash or helping somebody go to the toilet. But there's lots of other things that you need to take into consideration when you're doing that for somebody else. And then there's the other end of the spectrum. We are an acute hospital. We have acutely unwell patients, and we need to make sure that any deterioration in that patient is being recognised early, and we do that through taking clinical observations and teaching them how to escalate and communicate to other team members in an urgent yet appropriate manner so that the message gets through, so the help can get to the patients.
We secured funding from NHS England to support with the programme. We have maximised opportunities to attract local staff via social media routes, recruitment campaigns, marketing companies also.
We're trying to prioritise or get people in that are new to care as well, so we're kind of growing our own staff. So it's about preparing them and then keeping them going and helping them progress through a career ladder as well if they want to.
We introduced a career progression pathway, which means healthcare support workers can develop through to senior healthcare support workers, right through to registered nurse degree apprenticeships. We have had targeted recruitment events that we've facilitated with open days, local market stalls, promoting at local colleges. We're also working in partnership with the local job centre to maximise opportunities across the NHS. The vacancy gap so far has reduced significantly, which has had a positive impact on the care that we deliver to our patients. We'd like to thank the clinical teams for their support with the centralised recruitment approach to healthcare support workers. I'd also like to thank everyone within the human resources and education teams for their continued dedication and communication throughout the programme.
I would like to thank all of the team members in the education and development team, and actually in recruitment as well, because we all work together very hard to maintain this momentum.
WALANT stands for Wide Awake Local Anaesthesia No Tourniquet. This is a service which is safe, efficient and cost effective. Where many patients with wrist, hand and some elbow surgical conditions can be treated safely outside the theatre complex and in an outpatient, more relaxed setting with great patient satisfaction and experience. When we apply a tourniquet normally to a limb, it causes discomfort and pain, especially when the procedure lasts more than 10 minutes. With WALANT surgery, we introduce a calculated mixture of local anaesthesia and adrenaline, and this would eliminate the need for the use of the tourniquet, and allow us to expand the range of hand and wrist conditions that can be treated in this way with much better patient satisfaction and experience. WALANT service has endless benefits to patients, staff, hospital and trust, as well as the environment. Also, patients who are not suitable to have general anaesthesia due to medical complexity can have their operation through the WALANT service safely. And another benefit to patients is that not only that they don't need to fast before this procedure or stop any of their medications, including blood thinners, but also because they're awake and responsive, we can use this time of surgery to educate the patients about how they look after their wounds, how they look after their limb after surgery, give them information about the aftercare, removal of sutures. The patients feel more relaxed, more engaged, and very satisfied from the feedback that we get. They get to stay in the hospital for less time, and even their recovery is much quicker. We're freeing up theatre space, we're freeing up bed space. We're needing less staff where we have 4 members of a team running this service compared to previously having 8 in main theatres. Expanding this service was fantastic because we managed to gather more people around, and the staff have found it very satisfying as they get endless compliments from patients that going through the Wallant service. They get the opportunity of training and expanding their professional skills at the time of working in this service, which gives them great job satisfaction and increase their morale. The Wallant produce less than quarter the waste that is generated in the main theatre for a similar case. This service has been also nationally recognised in our trust through the NHS England Get It Right First Time programme, which is designed to improve patient care and patient journeys. Waiting time have been reduced after the introduction of Wallant service, and we're expanding this service even more by training more staff. I would like to thank my fantastic Wallant team for this superb patient care that they're providing. I would like also to thank the outpatient sisters and outpatient theatre sisters as well for providing training and quality assurance outside the theatre environment.
At the outset of the pandemic, I was tasked with setting up an early supportive discharge team to help support respiratory patients and those with COVID to be discharged from hospital early. We were one of the first trusts to set up an early supportive discharge team. We know that patients recover more quickly at home. They have less chance of getting hospital-acquired infections, and psychologically it's better for them. The multidisciplinary team includes the respiratory consultants, specialist nurses, allied health professionals and assistants, assess the patients on the ward and deem that they are suitable to join the early supported discharge service. Specialist nurses then prepare the patients for discharge and ready for their calls when they leave hospital. So this includes patients with short and long-term respiratory conditions, including COVID-19, where the recovery is really unknown for some patients. And I think the ongoing support of daily phone calls, reassurance has really benefited those patients. Prior to discharge from hospital, patients are provided with information pack, a pulse oximeter which measures patients' oxygen saturations. Their inhaler technique is checked, and any oxygen equipment which they may require on discharge is discussed, and they're advised how to use that. The patients are phoned consecutively for 7 days.
Hi, it's Elisa calling from the early supported discharge team in Hereford Hospital. Yeah, I was just calling today just to see how you are and just to ask you a few questions, if that's okay.
Then after 4 days, and then after 10 days, and if they are deemed stable, then a discharge from the service. During the telephone calls, they are assessed for their need for community physiotherapy or district nurses, and referrals to those teams are completed if required. Patient feedback is extremely positive. The fact that they have the support, reassurance and comfort of knowing that they're having a daily phone call when they leave hospital it has been really beneficial. We've had about 750 patients through the service currently, and all the feedback has said very similar. Setting up the service, I think, within such a short time frame and having the support of Y Valley and external resources has just shown that even at the most challenging times it is possible, and that patient care is high on everybody's agenda. We'd like to thank the whole respiratory team that have supported discharge service, especially the 4 assistants that carry out the phone calls on a daily basis and provide the support and do it in a very empathetic way.
We have a national shortage of registered nurses in the UK, and we have the hard to fill gaps, especially in the nursing workforce here. We have to ensure we maintain a nursing workforce for our patients, for their safety and their care across the county here at Herefordshire. And it's important that the team do what we want them to do, because that maintains our service. We actually recruit our nurses from overseas. We work with our recruitment agencies that source and vet the nurses and screen them before arrival.
Before our nurses arrive here in the UK, they have already completed their language competence assessment and their computer-based theory test, which demonstrates their competence within the nursing profession. Once they've arrived, they then have to complete a training programme with us that will support them onto the to go on to pass the final part of the registration process, known as the objective structured clinical examination.
We make sure that every nurse who arrives is well looked after, is actually met upon arrival. We have like a three-prong effect. We have pre-arrival, arrival and post-arrival. So on the pre-arrival, pastoral officers will actually engage with the nurses that are due to come over, and they'll have a Teams call, because obviously they live in different parts of the world, and we will actually talk to them and say, you know, this is the process, we'll meet you and greet you on arrival. And then we have the arrival, where we actually take care of them, we take them to the banks, we look after their welfare, we actually involve them in transition stage to actually meet other staff in the trust from different cultures and nationalities, and we also support their families coming over as well. And then post-arrival, we have to really make sure that they are settled in well, that they can take their OSCE examination and become a registered nurse in the trust.
Many of our nurses that arrive into the UK are often really experienced nurses with massive backgrounds in healthcare within nursing. They've often had managerial roles in their previous experiences within the nursing profession. We have delivered a programme of training to our new international nurses through a classroom-based approach using blended learning. So we've used some role play, we do simulation, we do question and answers, presentations, just to support our international nurses into the programme to enable them to successfully pass their exam.
It's a team effort. It comes from obviously the exec sponsor, which is our Chief Nursing Officer, and from that it's the clinical and the nursing teams, it's the educational teams, the practice facilitators who do the OSCE preparation and training, our recruitment team and our pastoral team.
I think it's about recognising that it's an overall accomplishment within the trust, but especially the clinical managers and the staff that support them out in practice, because that transition is really felt on the ward level, and it wouldn't be possible if they didn't have that positive experience.
In the last 3 to 4 years, we've recruited over more 300 nurses from various countries across the globe, and the retention has been really good here. They tend to bring all the families, which is great because they settle. The children attend local schools and colleges and nurseries as well. We've been recognised as a best practice model on NHS Employers website, and we've also been praised by the CQC for our great work we do here.
We've had many nurses go on to become senior nurses within their wards, moving around the trust within the organisation to get the senior positions, and it's really lovely that they're able to role model then to our new arrivals that they've got them aspirations going forward.
I feel very proud and privileged to have made a difference to these nurses' lives, not just myself but my team. They work really hard. I'm proud of their efforts and their dedication, and we also go the extra mile. We go extra 1,000 miles really to make sure that they're safe and that they've arrived here. I'd like to thank everyone involved. It's not just one person, it's not just two, it's everyone. It's from the taxi driver that picks them up from the airport to the clinical nurse on the ward, to the practice education team, to the recruitment team, and we are all passionate about making sure that they have a safe journey as well. It's also a dream that these nurses have from India and the Philippines and Middle East that we bring them from, and their dream is to live and work in the UK to actually support their families back home. I'd like to thank our international nurses for making that long journey and also for leaving families behind, because I know it's not easy to leave children behind and partners and husbands and wives. So I'd just like to say a really big thank you to them for their continued professional care that they give to our patients in Hereford.
Hi, I'm working in the pediatric department. First of all, I have to say I'm very happy to be working in this organization, and I am so happy that I could come here in UK and work here. Previous my experience was in pediatrics, so I got here in pediatric only. So I love kids. I enjoy working here. There is no stress. I'm so happy here to work, especially in the pediatric ward. Thank you so much.